Hello, my name is Toe Beek and I'm a student at UNC Chapel Hill, and I will be performing today the head to toe assessment with my participant. Before I begin, I want to make sure that I ask the patient to empty his bladder fully so that he's comfortable. I also want to make sure that I've reviewed all pertinent vital signs and laboratory values. As well, I want to make sure that I wash my hands as I enter the room and ask the patient for any feedback, as well as explain what I'm doing throughout the examination. Throughout the exam as well, I want to make sure that I assess the patient's skin as well as mental status as we go. And now I'm going to tell you 3 words that I want you to try and repeat back to me at the end of the exam. Red, bicycle, wind. Okay? So without further ado, we'll go ahead and begin the exam. So the first thing I want to do is I'm going to go ahead and assess the upper extremities. I'm going to assess the skin. What I'm looking for here is the skin pattern, the hair, as well as looking at for any scars or any lesions. I want to assess the temperature as well, look for any edema. Assess the symmetrical muscle mass of the upper and lower extremities. I'm looking as well as the capillary refill at the nail beds, assessing for any signs of clubbing. I also want to make sure that I palpate the radial pulses and they are equal and symmetric bilaterally, so this is good. I then want to go to the head and the scalp assessment. I want to make sure that I assess for the hair pattern on the patient. I'm going to go ahead and palpate, assessing for any nodules, any tenderness or any abnormalities there. I'm going to go ahead and palpate for the facial structures as well. I'm going to ask the patient to open and close his jaw. Good, thank you so much. I'm assessing for any clicking, and then I'm going to go ahead and palpate the sinuses, which I could also percuss. If they were tender, then I can go ahead and progress to transillumination. Next, while we're here, I'm going to go ahead and assess for the cranial nerves. So I'm going to ask the patient to go ahead and clench his teeth. Good, squint your face really, really tight. Good, lift up your eyebrows, wrinkle the forehead. Good, puff out the cheeks. Good, and smile. Good, excellent. So all the cranial nerves are intact there. That's perfect. Then I'm going to go ahead and here I'm going to assess for sensation. I have a dull end and a sharp end. I'm going to go ahead and ask the patient to close his eyes, tell me what he feels and on which side.
Right sharp, left dull. Right sharp, left dull. Right sharp.
Good, perfect. So this is as expected. So next what we're going to do is we're going to go ahead to the eye examination. So I'm going to go ahead and first and I'm going to inspect the eyes. I'm looking for any obvious signs of ptosis. I'm also looking at the conjunctiva as well as at the eyelids, at the sclera and all those landmarks as well. Then what we want to do is I'm going to go ahead and do the EOM exam. So I'm going to go ahead and have the patient keep his head nice and steady. Go ahead and follow your finger with my, go ahead and follow my finger with your eyes. Good, perfect. Then I'm going to go ahead and assess for the fields of vision. So I'm going to first test for the peripheral fields of vision. Tell me when you see my fingers.
I see them now. I see them now. I see them now.
Perfect. In a pediatric patient, it would be very important as well to do the cover-uncover test. So next what we're going to do is I'm going to go ahead to the pin light here, and I'm going to assess for light accommodation and perla. So I'm going to go ahead and shine this in your eyes. Keep your head straight forward for me, please. Good. Good, very good. And that was nice and normal here. Now I'm going to go ahead and do the Snellen chart. This is assessing for visual acuity. This is cranial nerve number 2. It's very important as well to ask the patient if he wears any lenses, any glasses, or any contact lenses. This will be important for documentation purposes. So I'm going to hold this card 14 inches away from the patient. Good. Are you able to read this line?
I am. It is 859-40372.
Perfect. So that is 20/20 vision with his contact lenses in. So very, very good. Okay, so next what I want to do is I'm going to go ahead to the fundoscopic examination, looking at the red reflex. All right, so again, sir, just keep your eyes straight forward for me, please. Good, perfect. Okay, at this point in time, we're going to defer the corneal reflex exam, but what I am going to do is palpate the patient's eyelids very sensitively, and then I'm going to go ahead and palpate the lacrimal apparatus as well. So go ahead and close your eyes for me, please, sir. Good. No tenderness there?
No.
Excellent. Next, I'm going to go ahead and look at the nose. So what I'm doing first is I'm inspecting for any lesions, especially any signs of skin cancer or anything of that nature. Then I'm going to go ahead and palpate for any signs of tenderness or any abnormalities or nodules. I'm going to go ahead and use the pin light we used from earlier, and I'm going to assess the bilateral nares, making sure that they're nice and patent, as well as looking at the septum. Good, so perfect. Okay, and I do not detect any abnormalities there. Next, I'm going to go ahead to an ear here. I'm going to do unilateral, but of course in the real world, I would do bilateral. What I want to do first is I'm inspecting the outer lobe. I'm looking at the auricle, the pinna. I'm assessing for any earrings or any piercings that I might see or any signs of erythema or anything like that. Then I'm going to go ahead and palpate the auricle. Do you have any pain there, sir?
No.
Excellent. Next, we're going to go ahead to the otoscopic examination. What I want to do is assess the tympanic membranes, and I want to make sure that they're nice and pearly gray, maybe a bit of cerumen. For an adult, we're going to go ahead and pull the pinna up and back. Good, perfect. No abnormalities there. Next what I'm going to do is I'm going to go ahead and I'm going to do the whisper test. This is actually cranial nerve number 8. So go ahead and keep your head facing forward for me, please, sir. Let me know if you hear me speak.
Yes. Yes.
Good. Next, we're going to go ahead to the Rhine and Weber test. So this is assessing for bone and air conduction. I'm going to put this on top of your head. Let me know when you stop hearing it. I'm going to place it in front of your ear and let me know if you do hear it.
I can no longer hear it. I can hear it.
Good, excellent. So that's perfect. Next what I'm going to do is I'm going to go ahead to the lips and the mouth here. I'm going to go ahead and assess the lips, assess for any drooping. I'm going to look at the mucosa. I would expect it to be nice and pink. It's very important to assess the oral mucosa as it's evidence of perfusion there. We want to also make sure that we really look at the dentition of the patient. We want to make sure when we ask the patient to open up his mouth and say ah, that the uvula rises midline, and that it's a good chance to inspect the oropharynx and the mucosa as well. So sir, I'm going to go ahead and have you stick out your tongue. Good, and say ah. Good, perfect. And everything's normal with that. Today we are going to defer the gag reflex, but I'm going to go ahead and ask the patient to stick out his tongue, put it left, right. Good, go ahead and relax. Good. So that's the hypoglossal nerve, and that is intact, so that's fantastic. Then I'm going to go ahead and ask the patient to turn his head against my hand. Good. Other way. Good, and lift up against my hands. Good, so those cranial nerves are intact, so that's perfect. Next, we're going to go ahead to the lymph nodes. So what I'm going to make sure is I do preauricular, postauricular. I'm going to do the tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the infraclavicular. Good, and I do not detect any abnormalities there. I'm going to have the patient lift up their head slightly. Good, I want to look at the neck. I want to assess for any obvious signs of deviation or any goiters or anything abnormal. I want to go ahead and palpate. I'm going to palpate the carotids one at a time so my patient here does not pass out. So I'm going to go ahead and do one side. Good, and the other side. Good, and I want to gently palpate the trachea and assess that it's nice and midline, which it is. Next, we're going to go ahead and auscultate the carotid for bruits. So I'm going to go ahead and use the bell of the stethoscope, and I'm going to ask the patient to go ahead and breathe in and hold his breath. Good. Good, go ahead and breathe normally. Good, I do not detect any abnormalities there. So that's fantastic. So now I'm going to go ahead to the back of the patient. I'm going to go ahead and ask him to gently move this way. Very, very good. So what I want to do is I'm going to place my hands around your neck, okay, sir, and I'm going to have you swallow. Good, and that's assessing the thyroid during that examination. So now before we move on, I want to talk about the importance of the breast exam. This is very important for the males and females. We want to make sure that we talk about the importance of self-breast exam throughout our assessment, as well as that we assess the breast tissue as the patient's sitting, lying down, and lying down with their hand above their head, and making sure as well we palpate through the tail of Spence. I would want to make sure that I palpate the breast tissue in a circular motion, and also assess the nipples, and also palpate through the axillary lymph nodes. So that's something that we would want to do as well. Now, moving on, we want to go ahead to the thoracic and lung examination. So the first thing I want to do is I just want to look at the patient posteriorly. I'm going to go ahead and just inspect, and I'm going to assess the respiratory effort, which should be relatively effortless. And in this patient it is, which is what I would expect. Then I'm going to go ahead and I might palpate for any signs of crepitus or anything of that nature. I'm going to go ahead as well, and I'm going to place my hands on the patient. I'm going to ask him to say 99.
99.
Good again.
99.
Good again.
99.
Good. So we're assessing for tactile fremitus. As well, I'm going to place my hands on the patient, assess for respiratory expansion. Good. So big breath in. Good, and out. Very, very good. Okay, next we're going to do is we're going to percuss through the posterior lung field. We would expect the sound to be resonant. So, sir, just go ahead and breathe nice and normal, okay? Good. Now we're going to go ahead and we're going to percuss for diaphragmatic excursion. So, sir, I'm going to have you go ahead and breathe in and breathe out all the way and hold it. Good, very good. Go ahead and breathe normally. So I assess this about right here. So now I'm going to have you breathe in and hold it and go. Good, go ahead and breathe normally. Okay, so let's go ahead and measure this. And we have it at 5 centimeters. So this is what we would expect, and this is nice and normal. Excellent. Now I'm going to go ahead and auscultate through the posterior lung fields, and I would expect for them to be nice and clear. We're going to move from the posterior lung fields to the lateral sides, and then of course we would do the anterior lung fields. As I go throughout this, I want to make sure as well that I assess for the AP diameter. Before I move on as well though, I think it is important to assess for CVA tenderness. So sir, I'm going to go ahead and palpate, gently tap on your back. Let me know if you have any pain. Any pain?
No pain at all.
Okay. No?
None at all.
Okay. Now we're going to go ahead and listen. So sir, big breath out and in through the mouth. Good again. Good again. Good again. Good, 2 more. Good again. Very good. All right, we're going to go ahead to the lateral sides. So go ahead, lift your arm up for me, please. Good. Again, out and in through the mouth. Good again. Good, 1 more. Good. Move to the other side. Good, arm up. Big breath out and in. Good, 1 more. Good. Okay. And of course, we would also want to do the anterior lung fields as well, but everything is clear that I hear so far. So I'm going to go ahead and gently place this down. Next, we're going to proceed with the cardiovascular examination. So the first thing I want to do is I just want to inspect. What I'm inspecting for is any abnormal pulsations or any abnormal heaves or anything I see that is not quite right here. So I'm going to go ahead and palpate as well. I'm palpating for any signs of crepitus as well as any thrills. And next what we're going to do is I'm going to go ahead and listen to the 5 classical points. So we're going to go ahead and do aortic, pulmonic, Erb's point, tricuspid, and mitral. We want to do this with the bell and the diaphragm of the stethoscope. Okay, sir, so just go ahead and breathe normally, okay? Good. Good. So I did not detect any abnormalities there. So I'm going to go ahead and ask the patient to stand up for me. Good, and we're going to go around here and ask the patient to carefully go ahead up on the table. It's very important during your cardiovascular exam to assess the patient in at least 2 different positions. So I'm going to go ahead and gently place this down here. I'm going to ask the patient to turn his head that way. I'm assessing for JVD during this particular position. We're going to go ahead as well and listen to the heart and the 5 classical areas one more time with the bell and the diaphragm with the stethoscope. So go ahead and breathe normally for me, sir. Very good. So everything was nice and normal there. So I want to make sure as well that we assess the PMI for this patient. So I'm going to go ahead and palpate. Good, and then it's very important to assess the PMI and make sure as well that you assess the radial pulse and make sure that they are roughly symmetric and equal, which they are, which is very, very important. So excellent. So I'm going to go ahead and ask the patient to sit up. I'm going to remove these and ask you to please lay down for me, sir, as much as you can. Okay, good. And I'm going to lift this up, okay? What we're going to do is now progress to the abdominal examination. So what I want to do first is I'm going to inspect the abdomen. What I'm doing is looking at the color, the contour, the shape, as well as looking for any obvious signs of pulsation, which I do not see, which is great. The next thing you want to advance to is the auscultation. So I'm going to go ahead and auscultate through all 4 quadrants, which I expect to be active. Then I'm going to go ahead and use the bell, the stethoscope, and I'm going to auscultate the renal, iliac, and femoral arteries. So sir, go ahead and relax and just breathe normally. Very good. Good. And no abnormalities detected there. So the next thing we want to do is we want to go ahead and percuss throughout the abdomen. I would expect that to be tympanic. We're also going to go ahead and percuss the liver span while we do this. Good. Okay, so go ahead and breathe in for me, please, sir. Good. Good, so go ahead and breathe normally. So I detect a slight difference in that tone. So I'm going to go ahead here around the level or slightly below the umbilicus, and we're going to move up. Good, so again, a slightly different tone. So we're going to go ahead and measure. And I have here that we have approximately 6 centimeters. We would expect a measurement between 6 and 12 centimeters as about normal. So that is normal for what I have. So next we're going to go ahead and progress to palpation. So you can do light, medium, and deep palpation. And you want to be careful if you suspect organomegaly, which I do not based on the patient's liver span. So sir, it might be uncomfortable, but tell me if it's painful. Good, so light. Good, medium. Good, and deep. Good, and if indicated, you can go ahead and use the hook technique to palpate the liver. As well, here we're going to go ahead and palpate the femoral arteries. Good, which are equal bilaterally and symmetrical and strong. And then you can palpate the inguinal lymph nodes. Next, we're going to move on to the lower extremities. I want to assess the hair pattern as well as the skin here, assessing for any lesions or scars. We're going to assess the temperature for any dependent edema. As well, look at the toes for capillary refill and perfusion. And then we're going to go ahead and palpate the dorsalis pedis, which is symmetrical bilaterally and strong. So I'm going to go ahead and help my patient up here. Okay, sir. Thank you so much. Great. So next we're going to do is we're going to assess for sensation. So I'm going to go ahead and use this. I'm going to have you close your eyes. Go ahead and have your hand out for me there. Tell me if you feel it and on what side.
I feel it on my right.
Good. And where?
Finger.
Good. All right. And then go ahead and relax down. And again.
I feel it on my left foot.
Good. And where specifically?
Toe.
Good. Excellent. Okay, go ahead and open your eyes for me. So sensation intact. I'm going to do rapid alternating movements now. So I'm going to go ahead and have you flip your hands back and work as fast as you can. Good. Perfect. All right. Now go ahead and touch your nose and then touch my finger. Good. 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 Perfect. And then go ahead and touch your fingers to your thumb as fast as you can. Good, perfect. Okay, have your arms up. Go ahead and push towards me. Good, pull towards you. Good, push up, push up, push up. Good, back towards you, back towards you. Perfect, excellent. Now we're gonna go ahead to the reflexes. We're gonna do one side today. Normally you would, of course, do bilateral. So we're gonna go ahead and do the biceps. Good, so go ahead and relax as much as you can. Good, relax, relax, relax. Good. I'm gonna go ahead to the triceps. So I'm gonna flip your arm over, okay? Try and relax as much as you can. Good. We're going to do the brachioradialis, so go ahead and relax, relax, relax. Good. Right in my hand. Good. We're going to go ahead to the patella right here, so relax that leg as much as you can. Good. And then we're going to go to the Achilles. Good. Now I'm going to go ahead to the Babinski reflex. So I'm going to have his foot up here. Go ahead and go up here. Good. Might be a little ticklish, but should be negative, which it is. Okay, go ahead and relax down. All right, I'm going to assist my patient up here. Go ahead up here. Good. And turn around facing forward. Whoops, the daisy. All right. We're going to go ahead and bend forward for me, please. Good. What we're doing is assessing the straightness of the spine. Very important in the pediatric population. Go ahead and stand up. Good. Go ahead and hyperextend back. Good. Lateral bending, so side to side. Good. And rotate the trunk. Perfect. Okay, so go ahead and turn around and face me. Good. Go ahead and close those eyes. Good. Open them so we have negative Romberg. This is great. Go ahead and walk that way for me. Good, turn around, face me, and we're gonna do heel ball toe back. So heel to toe back. Very good, okay, and then go ahead please, you can tell us what are those 3 words that I told you at the beginning?
Red bicycle wind.
Excellent. Okay, well thank you so much. This concludes our head to toe assessment. I'll let my patient get changed and that's it.